Hi, good morning everyone. Today I would like to give a message to the entire world or to the audience. So everyone we take the medicines. So like our family or you guys take the medicines. So must be a lot of times we heard that side effect, adverse event. So what is that? So like if you get any side effect, adverse event, what we do? So like there is the one term called as a pharmacovigilance. Pharmaco means it's a drug, vigilance means it's a vigilance on that drug. So every pharmaceutical company has a responsibility to check whether whatever the molecule or drugs in the market, whether it's working fine towards the society. So like I'll tell you, before any product comes into the market, it get trial in the animal as well as the clinical trial human body. But in that time, so the patients, that group will be the restricted, the healthy volunteer or the patient with that particular disease. So when any molecules come to the actual work, then only you will have the data okay, what can be the happen. I will give the one example. So like it's a tragedy, thalidomide tragedy. Most of the people they heard, or most of the people they don't know. In like 1960, so in one of the German pharmaceutical company, they marketed one of the product which is for the morning sickness during the pregnancy. So like after 5 years, they have identified that after taking the thousands of women, so they get the birth defect in the babies. So like after 5 years, they experienced that because of this drug, so like thousands of baby died because of the birth defect. So later on, this 1960, so government has strictly provided that every pharmaceutical should have the awareness camp like a pharmacovigilance. They have to observe their molecules in the market, how it is working to the patients. So like I will say, how many, if you guys experience any adverse event, how you will guys react on that. So what's the procedure for that? So like with every product we get the leaflet along with that, right? So how many we guys read it properly, what is the written over there, so what is there. So in every medicine there is a one toll-free number, right? If you identified any, like if you example, if you take any medicines and you had some bad experience, side effect from this medicine, there is a clear cut, they have mentioned that if you identify anything, just call us. So like you have to call to the company and you need to provide the details, what medicines you have taken, when you have taken, so what experience you are feeling. So company gather this information, they do the risk benefit balance, whether really that because of these medicines these events is happening. So on that basis company judge if there is a risk are more or benefits are more. One more example on the risk benefit I will say, like minoxidil. Like most those having the less hairs, they must be know the minoxidil. So like minoxidil is the drug which is invented for the antihypertensive. Okay, initially people has taken this medicines for the hypertension. Later on, after study on this molecule, company come to know that there are a lot of side effects for the minoxidil, like excessive hair growth. Later on, this drug banned for the antihypertensive, and this drug has started for the hair growth. So these are the benefit for that drug, but that was the disadvantages for that drug also. So when company come to know, when people are aware about that, they reported their events to the company, then company gather that information and come to know because of this drug that can happen. So every individual has the responsibility to if they experience anything, to report to the pharmaceutical company. Like pharmaceuticals company, they spend billions of dollars for the pharmacovigilance. These are the non-productive, they don't generate single rupees from this department, but it's the regulatory compulsion. They have to maintain this department to observe how this molecule is working in the actual condition. Like in studies, they don't study on the pregnant woman, they don't study on the children, so they will not have the data. When they have the data, when actual public get this data, take these medicines and they experience anything, and they share this information with the client. And so like when your experience can save the other people's life. Like if you experience these things, so company can report that, and company can analyze and further conduct the study on that, and it can save to the others life. So be more responsible. Like India is like in the foreign country, they are more vigilant people. Like if they had like a single, if after taking medicine, if they fell down also, whether it is related to the drug or not, but they report it. So for us, it's our responsibility to report to the regulatories, to report to the company. So that's the message for me. Be aware. Your one decision can save others' life. Thank you.